Okay, ladies and gentlemen, thank you for joining us here. I'm 1 minute late. I apologize. It is 2:16 in downtown Grand Forks. It's time for our afternoon City of Grand Forks virtual news conference. Members of the media will hear from our panelists, and then we will have Q&A from the media after. As we get started here, we'll start with Mayor Brown.
Well, I want to welcome everyone to the Grand Forks virtual news conference Thursday, May 7th, 2020. Today, our panelists will include President Joshua Wynn of the University of North Dakota and Dr. Josh Steer, Director of Primary Care, All2 Health System, Sean McBride, Regional Epidemiologist for the State of North Dakota Health System, and then Bill Palmasino, Executive Director of the Grand Forks Park District. So I want to say thank you to all of us for joining us and staying informed. The weather is warming, people are getting outside a bit more, and there's an uptick in the collective mood, including how GF Smart Restart is ramping up the local economy. However, we must not let our guard down, and we must continue to keep up the physical distancing, sanitizing frequently used surfaces, practicing good hygiene, wearing face coverings in public, and staying home if you have any symptoms. I was sad to learn about our first death related to COVID-19 in Grand Forks County. She was a woman in her 90s with underlying health conditions, and my prayers are with her family. This reinforces the need to protect our most vulnerable populations as we continue to mitigate the spread of the virus. Thank you to everyone for doing their part for a GF Smart Restart. We've seen the serious approach that businesses and residents are taking in putting the health and safety of their employees, customers, and neighbors first. Businesses are taking this measured approach because they are listening to their customers and understand their customers want a safe environment. This is how the free market works. It's important we continue to support local businesses in ways that are safe, like curbside pickup, takeout, delivery, and where appropriate on-site with the standards and guidelines set by the state. Our goal is to keep our community safe while getting the economy going again. We can do both in a safe and prudent manner. The success we are seeing in the businesses reopening or expanding services is when they are doing it in a GF Smart way. We have assessed our 2020 budget situation and developed a course of action moving forward that will keep core services delivered to residents, along with closely monitoring the outlook for our 2021 budget and setting the course on a future strategy. This has led us to a better understanding of the long-term challenges we'll be facing as a community. Grand Forks has a history of resilience in the face of economic hardships, as well as natural disasters. But unlike the 1997 flood, this pandemic is global and will be prolonged. To enhance our community's response to this pandemic, I've been leading a group of knowledgeable local leaders who have been meeting over the past 3 weeks. This group includes some of our largest employers and represents financial services, retail, healthcare, manufacturing, education, development, government, for-profits, and nonprofits, ranging across the board of both public and private sectors. These are innovative people who reflect a wide range of community perspectives, and I expect to bring forth a number of their ideas and initiatives as early as next week. This will be a marathon, not a sprint, and having a vision for the future and the flexibility and resiliency to adapt to changing circumstances will be necessary for a successful GF Smart Restart and recovery. Earlier this week, we received news that a firefighter with our Grand Forks Fire Department tested positive for COVID-19. We have members of our fire department team that are quarantined, and fire station number 5 has been professionally disinfected and is back up and running. First responder services are continuing to be delivered, and we have Fire Chief Gary Lorenz available during the Q&A segment for any questions on the situation. We're pleased to be joined this afternoon by UND President Dr. Josh Wynn, and thank you to UND for their continued partnership. The relationship between UND and the broader Grand Forks community has never been better. And that's in large part because of President Wynn and his administration, and will continue with incoming President Andrew Armacost. This strong relationship momentum will allow the city and UND to come out of these difficult times firing on all cylinders, and we look forward to working with them in the future. We are pleased to have Regional Epidemiologist Sean McBride with the North Dakota Department of Health to talk about contact tracing. Contact tracing is a critical process in the effort to identify and contain the spread of this virus in our community, and we thank all of our contact tracers for their important work. We know the weather is getting nice, and I dare say that summer is around the corner. As such, we'll have Bill Palmasino from the Grand Forks Park District to talk about parks and facilities and some of their programming plans for the summer. I want to give a special thank you to the Park District for being a great partner and taking steps to help keep our community safe, all the while providing to continue much needed recreation opportunities for our community now more than ever. Now we'll hear from President UND, Josh Wynn. Dr. Wynn.
Thanks very much, Mayor Brown. It's a real pleasure to be with you and the other panelists this afternoon. UND values its place in the community, and we are very happy with the partnerships that we have. You know, the COVID-19 pandemic has had two major impacts, I think, on most of us, but especially UND. The first has been operational, and the second is financial. From an operational standpoint, we, like the other institutions in higher education in the state, have gone to an online format for our students. And because of the dedication of our students, faculty, and staff, we have made this transition with a relatively minimal amount of disruption, but it has been different. And one of the important impacts of the physical distancing that is so important that Mayor Brown touched on is that unfortunately we will not be able to have in-person commencement this year to celebrate the graduation of our class of 2020. But I would invite everyone who is in the community to join UND for our first ever virtual commencement ceremony that will take place a week from this Saturday at 10 a.m. in the morning. So we will have simultaneous but virtual commencement ceremonies for our law, medical school, and then undergraduate and graduate graduates to be a week from Saturday. So I hope that you can join us. The other impact of COVID beyond operations is financial. UND, as with many other businesses and institutions, is taking a financial hit. We are dealing with it. We've been taking a number of actions, and we believe that by being prudent about this, that we will weather this storm and come through it on the other side, but not without some sacrifice on behalf of our employees. So we're very grateful to them for working with us as we weather this unprecedented challenge. So we are looking forward. I think the important word, perhaps the single most important word that the mayor used when he talked about the restart, is the word smart restart. And I would just reemphasize his caution to not let us be duped into letting down our guard just because it's getting nice outside. North Dakota has thus far weathered the COVID-19 pandemic relatively well. And it's because, as the governor likes to say, the citizens of North Dakota have combined North Dakota tough with North Dakota smart. So on the one hand, we've rolled up our sleeves and we've figured out a way to get through this challenge. But on the other hand, we've continued to be smart about it and to continue those practices that help keep us safe, and especially our friends, neighbors, and the community safe. So UND is very proud to be part of this community, and we look forward to continuing to work with the city, the county, the hospitals, and the other important constituents of the community. Thank you for asking me to join you today.
Well, thank you, Dr. Wynn. Now we'll hear from Dr. Josh Deere, Director of Primary Care, Alter Health System. Welcome, Dr. Deere.
Thank you, Mayor Brown. Good afternoon, and thanks to local media for joining us. I'll begin today by sharing Altra's key statistics. As of this morning, we've completed a total of 3,044 tests. This week, we've been testing about 80 patients per day. We're seeing lower numbers on the weekends and evenings, so we will be reducing hours of operations at our sick clinic beginning this weekend. Please visit our website for details. Our inpatient capacity remains comfortable. We currently have 8 inpatients in our hospital with COVID. As I wrap up today, I'd like to share a very heartfelt thank you to all the nurses during Nurses Week. Personally, I started as a 20-year-old volunteer in the ER, became a medical student at UND, then attended residency at Altru Family Residency, and I'm a family physician. And I am and have been thankful to be teamed with my nurse colleagues. They're true mentors and are invaluable. Their flexibility and commitment to our patients is shining now more than ever. Day in and day out, nurses show up ready to give their all for the well-being of others. For that, I'm incredibly grateful, and thank you.
Thank you, Dr. Deere. And now Sean McBride, Regional Epidemiologist. Welcome, Mr. McBride.
Good afternoon. Thank you, Mayor Brown, and thank you to the City of Grand Forks for inviting me to speak with you today. As the Mayor had said, my name is Sean McBride. I'm the Regional Epidemiologist with the North Dakota Department of Health. And with the emergence of the COVID-19 global pandemic, there's been some interest in the process of contact tracing. And so I was asked to speak with you today a little bit about that. I plan to do a brief overview and then a few comments on it. So contact tracing has been a long-standing public health tool that's been used to track and contain communicable illnesses. In the past, we've used contact tracing to contain things like vaccine preventable diseases such as whooping cough or measles. It's been used to track sexually transmitted infections, tuberculosis, and now it's being used to track and contain COVID-19. The general idea of contact tracing is to understand where an infection may have come from, but more importantly, where it might be going so that we can head off the spread and prevent it from impacting more people. Contact tracing, it's really a partnership between the public health workers who are doing the work and the individuals who become ill and infected. We can't do this work without them. They're partnering with us to help identify people who've been in close contact and establish the timeline for their exposure, so the period of time when they could have been around somebody who could have made them ill, and also when they're around people that they could have unknowingly infected. And so for COVID-19, the exposure period is generally 14 days before someone has developed symptoms. The period of infectiousness is a period of isolation, which is defined as the day of onset plus 10 days with 72 hours of being fever-free and an improvement in respiratory symptoms. Once someone meets that criteria, they're no longer considered infectious and they no longer need to isolate from those around them. Although we still recommend that people practice physical distancing, wearing a mask, and those other hygiene practices that can prevent the spread of COVID-19. And we do that because right now, there's not a lot of knowledge on the immunity of individuals who've been infected and recovered. And so we want them to take all the precautions that they can to stay safe and healthy. I want to make a brief comment on privacy. I think it's understandable that there are some concerns about the privacy of the individual being interviewed or the contacts being notified. And I certainly understand that it can be a little concerning or intimidating when you have a phone call out of the blue from some unknown public health official who's contacting you and asking about everywhere you may have been in a period of time or everyone you may have been around. I can certainly empathize with concerns and privacy concerns that might go along with that. And so I want to mention that privacy is really paramount to the work we do in public health. We need cases, individuals we speak with to understand that their privacy is very, very important to us. And we can't expect someone to share these details with us if we can't ensure that their privacy is protected. And so I want to make sure that people know how important privacy is to us and that we make every measure we can to protect the privacy of cases and contacts. Most often when we do share any information, it's only the information that's required for people or organizations to take measures to protect their own health. And so that might be letting someone know that they could have been exposed so they can quarantine away from others. But when we do that, we share only the information that they need to take those health steps and avoid sharing any information that may identify the individual who provided us the valuable information and partnered with us in identifying people who could have been exposed. Once exposed individuals are identified during the interview process, then we can use an intervention measure. And with other illnesses or infections, there are options like medications or vaccinations that we could use to prevent people from developing an illness. Unfortunately, in the case of COVID-19, we do not have treatments or other tools available to prevent someone who's been exposed from developing an illness and potentially becoming infectious. And so the intervention tools we do have are the isolation of symptomatic individuals and the quarantine of those who are exposed to prevent further spread. Symptomatic people, and I mentioned this, are asked to isolate for the period of time of their till recovered. And then contacts are asked to quarantine for 14 days after their last exposure. The reason we use the 14-day period is the incubation time. So the time it takes from when someone's exposed until they develop illness is a range of 1 to 14 days. And what we want to do is prevent anyone during that time from unknowingly becoming ill and infecting others during that time when they could develop illness. And so that's the purpose of the quarantine, is to prevent further spread. Now, also another step that we're doing when we identify close contacts is we're doing active symptom monitoring. And what that means is the health department is reaching out to individuals who are close contacts and helping monitor their health, daily temperatures, other symptoms like a cough, muscle aches, those types of things, and we're checking in on them. That used to be a pretty manual process with either a phone call or a text from the individuals, the caseworkers following close contacts. We have a new system now that's made that pretty automated, which is very helpful for not only the caseworkers, but the contacts who are being monitored. We can send an automatic survey daily through email for them to complete that symptom monitoring. The reason we do this is because we want to make sure that if someone were to develop symptoms, that we can get them the critical health information that they need at that time so they can take the appropriate steps, not only to protect their health, but protect the health of others around them. So that is essentially the contact tracing process in a nutshell. There's a lot of nuances and specifics that go in and out of it, but the general idea is to use cases to identify a time period for exposure, identify individuals who may have been exposed, and quarantine them to prevent further spread of the illness. The last thing I'd like to mention is I'd just like to take a moment to speak to the importance of personal decisions and prevention measures in fighting COVID-19. We know that COVID-19 can be transmitted before someone is aware they are ill, or by someone who may never end up developing symptoms. And these two features of the virus are what has made it so challenging to contain. It does not mean, however, that we are powerless to prevent it and to contain it. What it does mean that we have steps and prevention measures that can account for this. I still believe that our community can impact its own fate. As we all look to the next phase of the pandemic response and as businesses return to operating, it's more critical than ever that we are conscientious about how each of us can take steps to prevent the spread of COVID-19 and protect our community. As has been mentioned probably every time, more than once by many of us in the health field, this means wearing a mask whenever out in public. It means maintaining physical distance as much as possible between others when leaving our homes and entering spaces, public spaces or visiting businesses. Be aware of your own health. Stay home if you feel ill or experiencing any symptoms. And then continue to practice that exceptional hand hygiene that we've all become very familiar with. And I'm going to be honest, it's going to feel weird for a while. Wearing a mask isn't something we're used to doing. And so it's going to take some conscientious effort by all of us. And I try to look to, for my own personal experience, look at these practices as signals of solidarity between us and other community members. Each of us can make these small decisions that can have a cumulative, large preventive impact on Grand Forks. Thank you.
Well, thank you, Mr. McBride, for reinforcing the guidelines that will help keep our community safe. Thank you very much. And now we'll hear from Bill Palmasino, Executive Director of the Grand Forks Park District. Welcome, Mr. Palmasino.
The opportunity to share the Grand Forks Park District's North Dakota Smart Restart Plan and answer any questions regarding our plan. During phase one, we have the following facilities open: the park office, outdoor playgrounds, golf courses, tennis and pickleball courts, ball fields, and open spaces for people to enjoy. Choice Health and Fitness will open May 18th. The Park District is putting together a tentative plan for our summer recreation program and are currently working with local sports associations to help them with their plan for a safe startup. We are currently also working with park districts throughout the state of North Dakota to put together guidelines to open additional facilities safely, so we are all following those same guidelines. So at this time, I will be available for any questions, and I thank you for the opportunity.
Thank you, Mr. Palmasino. So now we'll go to the question and answer portion of our virtual news conference. And on staff, we have Todd Phelan and Fire Chief Gary Lorenz to help us with any questions that come up. John Bernstrom.
Thank you, Mayor. Again, use the hand raise feature as everyone is getting used to. And our first question this afternoon will come from Mr. Neil Carlson. Go ahead, Neil.
Yeah, my question is for Sean. I'm not sure if you can address this specifically. If you can't, maybe you could speak in general. The outbreak at LM Wind Power, we now had, close to 150 confirmed cases. But if you can talk about the contact tracing, how many people wind up being involved in all this by the time you get to the end of the trail? I mean, there was almost 900 employees. And then, so who did they have contact with? Are we talking about 1,000 people, 10,000 people? You kind of speak to that.
Go ahead, John.
Thanks for the question. I think you raise a good point about how cases can have kind of a rippling effect through their social contacts. While I can't speak specifically to the number of contacts we identified, I don't have that number off the top of my head. On average, we're identifying about 5 to 6 contacts per case. And that can be people who live in the home with cases, people who've had close social contact during their infectious period, or coworkers or healthcare workers. And so I think you could see that when you have a large number of cases, there can be a large impact on the community as a whole. And we do interview every case and follow up with every contact, but I don't have the exact numbers of all contacts identified at this time.
Thank you, Sean. Next question from KNOX.
This question would be for Mr. McBride and Mayor Brown. You can each speak to it. So we're told to wear masks whenever we're in public. Whenever we've asked about what the metric will be, when that will be dropped, no one has any answers for us. We hear about a new normal. Is it your intention to tell us that we'll be wearing masks for the rest of our lives when we're in public? And if not, can you tell us what metric you look for when it's safe to go around without a mask again?
Let's go first to Mr. McBride on this one.
Please.
Yeah, thank you for your question, your comment. I think, when we look at mask wearing, and this is certainly not something that we're looking at having needed to be done for the rest of our lives, but it is something that is important while we're trying to prevent spread of the illness. This prevents people who are asymptomatic or pre-symptomatic from being as easily transmissible to others. It keeps those respiratory droplets contained. And so with the metrics that we would use, I mean, I'm certainly not involved in developing the policies for when we make those recommendations, but that's going to be based upon potentially the number of people who may have developed immunity, either from a development of a vaccination or from an infection. It's going to be a number of the metrics that we're using right now to determine our phases of reopening North Dakota and businesses and determining what the impact of the illness is on our community. So it'll be many of the same metrics we're currently using to make policy decisions.
So for now, we're asking.
So to be fair, so to be fair and a follow-up, we wear the mask till you tell us we're not supposed to anymore. That's the best we can do with that question.
I would think so. We will continue to follow the CDC guidelines to keep you and our community safe.
Next question from Mr. Joe Bowen. Go ahead, Joe.
Thanks. So it's actually pretty perfect that you're saying about what metrics you would use to determine phases of reopening North Dakota. What sort of data are you guys looking at when you determine maybe we should take a step back, maybe we should stand pat, maybe we should loosen restrictions? What will you be looking at there?
I'm thinking Mayor Brown. I'm thinking Mayor Brown on this one.
I'm anxious to hear from the epidemiologist on this too.
Yeah, I'd like to hear from Sean if possible.
In just
No
a minute,
offense, Mike.
but right now we're in consultation with the health system, and when Dr. Weiser, Dr. Deere informed me that they're getting concerned, then we might have to ramp up our protections in the community. But right now we keep communication open and we follow the statistics. And now, Mr. McBride, as an epidemiologist, what can you add?
I think the governor in his conferences has done a pretty good job of outlining the statistics and the data that we're using to determine what the trajectory of the pandemic is in North Dakota and the community. And so those are going to be things like the percent positivity rate, the capacity for testing, considerations for local public or local health capacity. So how many critical cases and hospitalized cases are we seeing, and what's the rate of that? Those are going to be, it's a complex decision. And I think the governor's talk has done a good job of outlining what those measures are for making those determinations.
Yeah, this is Josh or Dr. Deere from Altru. We, from a bed capacity standpoint, we have 147 patients inpatient today. 8 of them, as I stated, are COVID positive. Our tier 1 capacity is 227 beds. So our bed capacity right now is really good. We feel good with our tiered approach to being able to care for the community. And as of now, the health system is functioning well.
Thank you, gentlemen. Next question from Mr. Neil Carlson. Go ahead, Neil.
Sean, again, I guess related again to testing and contacts. Let's say, for instance, the whole state is tested and contacts are traced, and okay, we've found out who everybody has. But in North Dakota, in Minnesota, in every state, isn't all this at risk again? As soon as we start traveling again in between each other, you once again put certain populations at risk, whether it's the truckers coming in, whatever industry you want to name it all. I think there's a question there, but that doesn't this kind of all go at risk again as soon as once the economy gets going?
You bring up another good point that, we all are interconnected. We live in a much more global society than we ever have. And you saw the spread of COVID-19 as it moved across the world and throughout the country. So certainly, we have to continue to practice these prevention measures as things open up to prevent and contain any outbreaks. That's why contact tracing is so critical and why testing is so critical, so we can identify cases early and intervene and prevent further spread. And so as things open up, it could lead to more cases, but we have hopefully done a good job of buying ourselves time and building capacity to respond to cases as we see them.
Thank you, Mr. McBride. Next question, KNOX.
Thank you. So for Mr. McBride, let's take the other end of Neil's question and approach it from the other side of the coin, which is that we had a major outbreak in Sioux Falls. They have 2,300 positive cases in Minnehaha County as of today. South Dakota's never had more than 76 people in the hospital statewide at one time with COVID. We had a major outbreak here at LM Wind Power. Dr. Deere tells us today it's 8. It was 7 a couple of days ago. I don't know that it's ever been more than 8 or 9. When are we satisfied that these outbreaks still would have to be much more than anything we've ever seen to overrun our healthcare resources?
To clarify my answer earlier, I think the determining these policies requires multiple data points, and so any one point might not drive the entire decision. I think right now, Dr. Deere absolutely makes a great point that Altru has done a good job of preparing and has capacity to respond to an outbreak. I can't speak to what policy decisions may be made, but we do have metrics in place to make changes, and what we're tracking, and the governor, I think, has outlined what North Dakota's plan is.
Thank you, Sean. Mr. Joe Bowen.
Hey there. Are there any substantive differences between GF Smart Restart and the decisions being made by the state?
I think we're in concert.
Mayor Brown.
I think we're in concert and continue communicating when we have our weekly meetings with the governor and his staff. So I think we're doing it together to protect both our community and our state. And I think our response to the healthcare system is we've done a good job, hopefully, with this distancing and the mask and the hand washing and the care we've taken to reduce the risk, the harm to our healthcare system. So it speaks well to the community that we've done as well as we have. We need to continue. You can't let your guard down.
Thank you, Mayor. As I look here to members of the media, yes, go ahead, Joe.
Yeah, my fault. I'm used to there being more people at these. So to clarify, what's the difference then between GF Smart Restart and what the state's doing? I mean, it seems
I
like you're
think
just calling it GF Smart Restart.
I think we're looking at what we can do as locally. That's why we have this business task force to look at what we can do as a community, how we can safely reopen our businesses and community to keep them healthy. So we're looking at a local approach, and we have the ability to have a local response if things look like they need to be responded to. So I think we're doing it in concert. Like I said, and I'm proud to have their help, and they're probably very glad we're doing our part too to help stop the spread in our community.
And Joe, to help answer that question, Mr. Todd Phelan. Go ahead, Todd. Oh, hold on there, Todd.
John?
There you go, Todd.
Okay, thank you. I think as the mayor said, the governor has been very good at providing local or state leadership, but it's important to note that we have to execute locally. And certainly Grand Forks is similar to many cities across the state of North Dakota, but we're different. And so that's why there's broad flexibility. We have different businesses, we have different industries, we have a different community, but we follow general principles. So I think what the mayor is doing is he's reaching out to our own business community, our own public sector organizations that we have, and to really nuance our own Grand Forks Restart. And the first part of executing any locally led plan is to listen to local folks, local industries, and that's what we're doing now. So I think as early as next week, we will have an action plan that will be certainly state guided, but it will be locally executed. Thank you, John.
Thank you, Todd. Yes, Joe.
Hey, so this would probably be a question for Debbie, but she's not here again, so maybe Sean can help here. My understanding is the reason that mass test on April 23rd happened, and the reason that, or not exclusively happened, but the reason that it was supposed to target, for lack of a better word, employees of Simplot was that the state or the city or somebody wanted to explore the way COVID-19 spreads in a warehouse type setting. Why was that important, and why did you want to explore that at Simplot specifically?
Go ahead, Sean.
Yeah, I'm sorry, I can't answer that question. I wasn't involved in the planning process for that particular testing event, so I really can't answer that.
Thank you, Sean. Mr. Phelan.
I think just to answer the most recent request to test at JR Simplot, really related to that, they were starting their Simplot up again, and as part of their 2-week cleaning and inspection and restart, they wanted to look at also checking their employees before they restarted their facility. So the most recent one was really requested by Simplot. Unfortunately, it had to be delayed due to state analytic issues and testing, but hopefully we can get back there. The mayor has requested that we honor Simplot's request to do a mass testing at that facility due to their request.
Go ahead, Joe.
Wait, I'm sorry. That April 23rd test, Simplot asked for you guys to mass test their employees?
No, I'm sticking to the most recent one that they requested.
Oh, okay.
Okay, we've got time for a couple more here. And as we're taking a look, anything else from you, Joe? Go ahead, Joe.
Yeah, sure. Sorry, a lot of these are about Simplot stuff, but Debbie's gone again. So how often does the health department here inspect bars or restaurants or fast food places right now, and how does that compare to the quote unquote normal rate?
I'm not, unfortunately, Joe, I'm sorry. I'm not sure if anyone is on
Right.
who has that. I understand your question, but
Sure.
don't have the ability to answer that one.
All right. Well, then I got a couple community comments. Yeah.
Oh, yes, Mayor.
We'll relay that and get you that information so you can get it out to the community.
Thank you, Mayor. What, time for one more, Joe?
Sure. Is there any sort of projected date for nursing homes to open back up? That's a community question I got actually a couple times now.
I have no information.
Yeah, and at our news conference, we had representatives from the nursing homes. It didn't appear to have an end date on it at that time. But that is where we stood. All right. Thank you, everybody. Thank you to our panelists for joining. Thank you to members of the media for your questions. And as we have ended these in the past, we'll end with Mr. Mayor Brown. Thank you.
Thank you. Well, I'm extremely grateful to our panelists, Dr. Wynn, Dr. Deere, Sean McBride, thank you for joining us today, and Bill Palmasino, thank you for joining us today. Again, here's your daily reminder on the following: that you must follow the CDC guidelines and practice physical distancing. We need to continue to be North Dakota smart, continue to wash your hands frequently, sanitize frequently used surfaces, wear a face covering in public settings, and practice good hygiene. The virus does not spread itself, we do, and we need to do everything we can to protect our most vulnerable populations. It's our responsibility to keep our community healthy, and practicing physical distancing and abiding by the CDC guidelines needs to continue being our highest priority. Stay vigilant, stay cautious, slow the spread, save lives. We're in this together, we'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor. Thank you, everybody, and everyone. Have a good afternoon.